Health of life, of life. Welcome to Health and Life. Like and subscribe now. The first month of pregnancy. In the first month of pregnancy, everything in your body is still common. If you continue to have menstrual regularity, then prove you are not pregnant. The first week. In the first week of your pregnancy, you can still have the baby and of course not yet formed. Can you slightly hard to understand? But the first day of the last menstrual period is the day that the doctor is the start of your pregnancy. Ovulation will not occur within 2 weeks. So, if you have the intended birth, you need ideological preparation and health before pregnancy. At best, you should plan to have children before conceiving for about 3 months. Change of the body. If you hope to get pregnant this month, you can start to calculate weight to the day of ovulation. However, this date is only approximate and even the doctor also could not confirm exactly, just as the moment of conception is very difficult to determine because you cannot know exactly when to egg and sperm met. The second week. Into the second week. Though counted as the second week of your pregnancy, but at this time you still have not conceived. This second weekend came about, your egg will fall into the fall pose. Before your baby actually begins to grow, it will go through various stages. The first is the increase in the amount of estrogen and progesterone, which flows through the blood to the uterus to form a rich, lush lining of blood tissue to support a fertilized egg to be passive essential. At the same time, in the ovaries, eggs are cooked in the bag containing the room, called a follicle. At the beginning of this week, usually on 14 of the 28-day cycle, the eggs fall, an egg will crawl out of the follicle and swept from the ovary into the fallopian tube. Change of the body. The second week of your pregnancy have begun, so please think about the pregnancy. The time of ovulation is the most important thing you need to know if the desire to conceive. Ovulation occurs when a mature egg is released from the ovary, fall into the hose and prepare eggs fertilized. The lining of the uterus thicken to prepare the eggs have been fertilized. If fertilization does not happen, the lining of the uterus will fall off. Eggs not fertilized, the uterine mucosa and loss flake formation phenomenon of menstruation. Third week. After ejaculation, millions of sperm will move from the vagina to the nozzle, where your eggs are waiting. Starting the third week, the egg is fertilized, has divided into hundreds of cells, called a blastocyst, a hollow spot that contains fluid. At this point, the embryo attached to the uterus, also known as the lining of the uterus. If successful, the plaque strawberry embryo fetus will begin to grow and receive nutrients from sticking. At the location where the strawberry embryo attached to the lining of the uterus will develop into the placenta, also known as the vegetable or the placenta. Change of the body. To the third week, strawberry embryo will start to secrete the hormone to the body. You do not liberate the mucosal cells and the tissue in your uterus, making you not see menses. In the third week of your pregnancy, you will not see your body change. Many women don't even know I was pregnant. Fourth week. In the fourth week, the cell zygote formed 3 layers, the outermost tissue, dermis, between tissue, mesoderm, in the same tissue, endoderm. This 3-layer will form the organs and tissue for the fetus. Foreign packs will become the nervous system, including brain, skin, hair, nails, hair, legs, breasts and legs. Mesoderm will develop into heart, system, skeletal, connective tissue, blood vessels and muscles. Endoderm that will form the lungs, intestines, liver, pancreas, and thyroid. Extremities started out but not pronounced papillae. The placenta also began to form and produce a number of important subjects including hormone will HCG. There is the movement of blood through the veins. Change the body. In the fourth week of your pregnancy, you may have the symptoms of reincarnation as both strained term breast, headaches, back pain, or some other expression. You should know that these symptoms are similar to the symptoms that you may have before term. The other woman didn't have any symptoms except late or irregular menstruation. If you experience loss, use pregnancy test sticks. Here's how to detect early pregnancy for the house. Health of Life. Welcome to Health and Life. Like and subscribe now.